And here's our guest. So again, allow me to start all over again. My name is Steve Meising. I'm a social media specialist in charge of live broadcasts at Rush. Thank you so much for watching. Today, our guest is Ravi Iyengar, a endocrinologist at Rush who specializes in LGBTQ healthcare. Thanks so much for joining us today, Ravi.
Yeah, thank you for having me.
So to get things started, tell us a little bit about what you do at Rush.
Sure. So, my name's Ravi Iyengar. My pronouns are he, him, and I am an adult endocrinologist here at Rush. And I'm also the medical director for Affirm, which is the Rush Center for Gender, Sexuality, and Reproductive Health.
Gotcha. And what made you gravitate towards your specialties?
Yeah, big question. I really enjoyed endocrinology just in my training, in my residency. I was always drawn to hormonal pathways, feedback loops,
Hmm.
diabetes care, nutrition, and it was really in exploring that I found this great partnership between a lot of the advocacy work I was doing in the LGBTQ plus community during college and medical school. And I found that the two of them just merged beautifully, which drew me into a greater focus on pursuing specifically gender affirming care.
Right. So the topic of today's conversation, since it is Pride Month, is talking about Affirm in specific, which was launched in the beginning of 2020. Can you tell us a little bit about why Rush set up this clinic?
Yeah. So a lot of the work was happening much before 2020. And it was really through a lot of the efforts of the LGBTQ plus Leadership Council that we recognized the need from employees, students who were seeking affirming care that was really not readily available or accessible to them. And through the council, they were able to push for a lot of policy change and just systematic change here at Rush, where prior to 2016, we became one of the first healthcare systems in Illinois that offered comprehensive affirming care for trans individuals. Um, Continuing off of that, we started incorporating more sexual orientation, gender identity information into our electronic medical record, and then repeatedly being receiving high marks on the Human Rights Campaign Healthcare Equality Index. So it was really not a huge surprise that Affirm was born out of all of this and really became a way to sort of systematize this process and ensure that um, affirming care and care for the LGBTQ plus community gets incorporated into a large healthcare system.
Right. And so what kind of services are offered through Affirm?
Yeah, so we are a multidisciplinary interprofessional effort that really spans across the entire Rush system for health. And at the core of Affirm is our patient navigation and our patient care navigators. Shout out to Morgan Yame and Willie Bassett, who are our two wonderful patient care navigators. And they are really the first line of contact for many of our patients and help to create this individualized care team surrounding our patients and based off of the needs of that patient. And
Hmm.
so we're connecting individuals to providers, services within the Rush healthcare system that one is familiar and knowledgeable and competent in affirming care and the care that patients require, and be able to provide that care at the level and quality of excellence that is known to Rush University. But and through those clinical connections, we're able to offer a wide array of different services, whether that's primary care, behavioral health, endocrinology, obstetrics gynecology, um, dermatology, and a wide array of gender affirmation surgeries as well, in addition to other services such as vocal coaching and so forth. But it's really not just the clinical aspect of care that we provide, in addition to that, we're helping navigate patients through other things, including legal transition, providing documentation, letters of support for patients, but also providing that education and training for a very large healthcare system. So we sort of have our hands in all different pots when it comes to our approach to affirming care and the services that we provide. But on a patient-centered level, we have a wide array of clinical services that we're able to offer.
Yeah, and wide, I don't think covers it. It seems very comprehensive. When you talk about training, can you tell us a little bit more what you mean by that? Because I'm very curious, like how what we tell our other providers, maybe who aren't part of a firm, how they can perhaps be more inclusive and more understanding to their LGBTQ plus patients.
Yeah, absolutely. And so this is, I think many of us at Affirm and everywhere really have a personal experience with going through healthcare training and going through a system that really didn't provide this type of education during our training, during medical school training, residency training.
Hmm.
And it really wasn't until recently that some institutions, not all institutions, but some institutions, including Rush, have really stepped up and been incorporating this level of training for all of our students and trainees in different areas of the Rush colleges. But for many of us and senior practicing providers, nobody has received any care or understanding of cultural competency when it comes to the LGBTQ plus community, services for the LGBTQ plus community, what are the medical needs, what are the healthcare needs, and so forth. And so we're trying to target a wide range and meet people at different levels of their training and familiarity with affirming healthcare. And that's one of the things that Affirm has been taking on at task for the past year or past couple of years. So that includes providing different levels of trainings or 101s, as we call them, for LGBTQ plus cultural competency, working more specifically with different specialties and different departments to provide more specialty specific training for patients, and then working with the entire Rush healthcare system to provide basic level of training for all employees entering and joining Rush, and also on a repeated basis for recurrent education and updates.
Right. So Affirm has officially been around for a little bit more than a year. How have things been going since its founding? Obviously, the pandemic was a part of that, but in general, how would you say it's going?
I think it's going well. We had a global pandemic, and despite a global pandemic, we have seen that we've really been able to reach out to a number of individuals, and our patients that we're reaching out to, patients accessing care, have really just consistently been increasing despite a global pandemic. So we already saw the need in putting a program like this together, but now we're actually able to see the results and the increase in those numbers with the services and the care that we're able to provide.
Right. And so with the pandemic, how did Affirm adapt to meet the needs of their population with the challenges that came with it?
Yeah, so I think much like everybody, we had to adjust to a new way of doing things and doing things on the fly, trying to determine whether or not we would be able to come into the office that day or be able to provide a certain service that day. And I think it was also with the advent of telemedicine that Rush was able to provide that really helped us to reach out to our patients, keep connected with our patients, establish new connections with patients who otherwise, due to distance and so forth, may not have been able to reach us as easily at Rush. That we were able to grow in our connections and provide the continued care that we needed to provide. Additionally, being able to reach out to patients, counseling on vaccinations, counseling on resources. We're already dealing with an already marginalized population, and now you have this added barrier of further isolation and a global pandemic. So reaching out to patients to help connect with resources in the community were all things that our team, I'm proud to say, were able to do so well.
And so, what did the pandemic teach you, perhaps, about how well, the best way to provide care for LGBTQ people? Were there any lessons that maybe came out of that for maybe something that's unique to your the population that Affirm cares for?
Yeah, I like that question because I think that at Affirm, we really pride ourselves on being a program that was built for the community and by the community. And many of us identify in the LGBTQ plus community. And it was really with this pandemic that we recognized the need to protect our own community, to be able to reach out and help our own community. And all of us came together to do what we had to do to provide that level of service for our patients, provide those connections to our patients. And so it just kind of reiterates the fact that community is there for each other, and we can't do this without one another, especially in continuing to build a program like this.
For sure. So, as you mentioned earlier, gender affirming care is a large part of what Affirm offers. Can you tell us a little bit about what is included in gender affirming care and why it's so helpful to transgender patients?
Yeah, so specifically with what I do, I provide hormone therapies for patients undergoing medical transition. And medical transition is for somebody who does not identify with their sex assigned at birth. It allows for transition to that patient's gender. And so, for example, somebody who was assigned male at birth, but who identifies as female, I'm able to provide hormone therapies to help reach that identity and strengthen that identity both physically and internally. So what I do is meet with patients, help them through this period of transitions with hormone therapy. But affirming care is so much more beyond just medical therapies. Affirming care may or may not include surgical affirming therapies as well. It may include legal transition, legal therapies, legal transition and documentation, ways to change gender markers, name changes, and so forth. So what we provide is all of that and avenues to help patients to achieve all different aspects of care, of affirming care.
And what kind of results have you seen? Not just specifically with perhaps your gender affirming patients, but the general your general affirm population.
Yeah, I mean, we have seen the numbers continue to grow in terms of the patients that we're able to reach and the care that we're able to provide for patients. I think speaking specifically as a medical provider regarding all aspects of affirming care, we know that it is necessary and that it's important and it is scientifically sound. And many organizations, including the American Medical Association, American Academy of Pediatrics, American Psychiatric Association, all back the evidence-based research behind the need to provide gender affirming services and gender affirming care. And actually, by not providing a lot of these services and not providing some of this care, we're actually doing more harm.
Right. And it's interesting that you mentioned sort of the how valuable this is because a lot of gender affirming care, from my understanding from some of my transgender friends, is that it's quite expensive and it's not always covered, especially by insurance to the degree that they want. So does Affirm ever work with patients to help them find ways to be able to afford the care that they so desperately need?
That is a large part of what we do. And so our patient navigation team certainly works with our patients on an individual level based on their insurance, based on what they're able to afford to help identify ways to get coverage for the therapies that are needed. But the work really doesn't stop there. It includes advocating for our patients on a broader level as well too, when it comes to insurance coverage and recognition of the need for such services and the care for such, or the quality of such services. So we do work quite extensively with many of our patients on this.
For sure. Well, thank you for doing that. It's really important work, and we're very thankful that people get to have access to these services. So to end on a fun note, how is Affirm planning on celebrating Pride this year?
Well, hopefully some of it in person, all vaccinated. But we plan to participate in different events that are happening this month. So we've helped to put on a couple of events here at Rush. We helped along with Rush Pride with a recent workshop in allyship just earlier this week. We are working to do or participate in a program called Pride Where You Are, which more information is to come on that later at the end of the month, for getting everybody in the Rush system able to participate. Ultimately, now that we know that the Pride Parade actually got moved back to October, maybe planning some things around that as well. But really trying to use this momentum to increase the access and the awareness for many people around the Rush Health system to what we do and the need for having this care throughout the entire year and not just in the month of June.
Absolutely. That's definitely the message that we want to take away from this. And I'll see you in October. I'll be marching there next to you.
Awesome.
Um,
Good.
well, we have to wrap it up. But Dr. Iyengar, thank you so much for taking the time to chat with us today. And thank you to everyone who's listened and participated and waved and sent comments. We really appreciate it. Please make sure to visit rush.edu for more questions, for more information, and stay tuned for more great live events like this. Thanks again, Ravi. We'll see you later.
Thanks for having me.
Bye-bye.
Bye.